Hello, this is Zarja from myTamarin, and this is our newborn studio where we talk about all things newborn. And today we're going to be talking about feeding. I'm excited to welcome to our studio Dawn, who has for the last decade been working as a private maternity nurse and newborn expert, working with individual families, and then before that for about 2 decades as a NHS healthcare professional, where she was leading sleep clinics and sort of providing other advice to parents with new babies. Welcome, Dawn.
Thank you.
So I'm going to start by asking Dawn, the first thing when we parents think about feeding is whether we should be breastfeeding or bottle feeding and what's the difference and which one is right. Can you talk a little bit about that?
I think fundamentally it's true to say that because breast milk is designed for babies, it comes directly from the mum, it's probably the optimum way of feeding a baby. It's not always possible. I think the first thing I would say is it's hugely important to recognise that and be respectful for mums who perhaps either make an informed choice not to do so, or for all sorts of reasons can't do it at all, or choose to supplement or need to supplement with formula replacement milks, because everybody is different. And I think the key to it is people getting the right advice so that they can make, as I say, informed decisions about what they choose, and as they go along, what is or isn't working, and to give parents support all the way along the line to help them make the right choices for their baby and for themselves.
Great. Yeah. So just wanted to emphasize, we're not judging, we're not recommending. Moms, families can choose either way or a mix of both sort of types of feeding. What we are here today about is either way you decide, how do you go about feeding your baby? Now,
Absolutely.
where do we start? Because, having had 2 babies and feeling like for the first, I don't know how many weeks and months they were just feeding is like, where do you start? How do you think about like how much baby should be eating or drinking in the first few days, weeks, months?
Okay, I think let's go back to the very beginning and look at newborn babies who may be quite sleepy for the first 12 to 15 hours after they're born. And the emphasis sometimes is to try and put a baby straight to a breast, and they don't always do that. So I think that's a parent's first point of potential anxiety, is that the baby doesn't immediately latch on like they might be expected to do. I think the key is that while you're in hospital, and I recognise that mums are now in hospitals for a very short period of time, to optimise the breastfeeding support that they can get if they choose to do that, or to seek other ways of doing it while they are in hospital with the midwife professionals guiding them, and to also make use of the domiciliary midwives and health professionals that come in those early days and weeks. Because getting it right is not always like falling off a log for parents. And I think there is so much literature out there and available about how all mums should be able to breastfeed, and this is how to do it. If it doesn't work for a mum, it can be incredibly demoralizing, and sometimes they plug along thinking that's what they should be doing, when actually if somebody had given them the right advice and practical sound advice based on what a mum needed, and worked in tune with her baby, then the outcomes for mums and babies would sometimes be a lot better.
Okay, so is it fair to say, Dawn, that babies don't come out starving, and that it's therefore okay to wait, allow the baby to latch on if the mom is breastfeeding, or wait a little bit with the first formula milk? Is that fair?
I think so. In most cases, all babies vary, and it depends on the type of delivery a baby's had,
Yeah.
for example. So, there are a number of factors which will influence that. But I think the key for me is for mums to feel free and comfortable to say to the healthcare professionals around them, could you please help me? Or this doesn't seem right. Or could you please help me with latching?
Yeah, or indeed, Dawn, I mean, given that we are recording this during the coronavirus outbreak, this type of service can also be delivered via video calls, right?
Yes, indeed, indeed. I mean, the health service is working quite hard to be able to provide what service they can via telephone or other links, although they are all very, very constrained. But there are other services that are available to support
Yeah,
with that.
including yourself, you can advise people over, or parents over video if needed, right?
Yes, as indeed would lactation consultants who are out there working as well. They're all working very hard to try and maintain the service within the current
Yeah.
limitations. Yeah.
Okay, so let's get back to the beginning then. First feed. How much will the baby need?
Your baby may sit there suckling quite happily for 15-20 minutes. They may take a few minutes and then fall asleep. The important thing for mums to remember is that the babies will probably be much more likely to feed little and often in those early days, because they will be producing colostrum, which is the very high fat rich, nutrient rich, immunity rich milk that is produced for the first 3 days before the first milk starts to come in. And your baby's feeds will be quite random, but you would expect over the coming days and weeks for the feeds to settle into a more regular rhythm. But again, all babies will vary.
Okay, all right, so what is the frequency of feeding in the first day, the first week, the second week? Does it change?
It does indeed, as indeed every baby will change. I think it's important to recognise here that we are talking probably about babies who are pretty much full term, because if they're very premature, the parameters are going to be different. And I think this isn't the place to kind of be discussing those particulars. But if a
Sure.
baby is full term, then you would expect a baby probably to be feeding anything from 2-hourly to 4-hourly, but you would be looking at that as an overall of 24 hours. So babies don't work on a day-night rhythm, they work on a 24-hour clock. So if you were to be able to feed your baby a little more frequently during the day and build that up gradually and steadily as a pattern, your baby will get more nutrition in the day and need it, hopefully in the fullness of time, a little bit less during the night. No
Okay.
guarantees, but that would be a good principle to follow.
So let's do a little math here. You said like they would feed every 2 hours. So that's about 12 feeds in a 24-hour cycle. So that's an important number or benchmark for parents to keep in mind. That's a lot of feeding. Now, just to be clear, when we say every 2 hours, that is 2 hours from the beginning of last feed or the end of last feed.
The beginning of the last feed to the beginning of the next. Having said that, I would qualify by saying babies will probably not feed 2 hours every time. They may do a 2-hourly, they might do a 3-hourly, they might do a 4-hourly.
But in the early days, it can easily happen that the mom is going to breastfeed for an hour, and then in the next hour the baby's going to want to feed again, and it's going to be fine because that's still like 2-hourly, right? And that can lead into that I guess life of constantly feeding, because ultimately then you're feeding half of the time.
That's an interesting point, actually, Zarja, because what I would say in my personal experience is that once you've established your breastfeeding over the first week or two, you try not to feed a baby for longer than 30 to 45 minutes if you are breastfeeding. Now that is because, as you've already pointed out, if a baby feeds frequently, you are rolling from one feed to the next. And also, although some people would advocate having a baby to feed for as long as they want, I personally believe that they would take, if they're feeding well and effectively and the latch is good, they're feeding most of what they need in the first 20 minutes, and then they get a chance to suckle. So 45 minutes, if they haven't taken what they need, then it's probably better to end that feed and start a new cycle next time. There are always exceptions to that, so I'm saying that with caution. This isn't a normal, straightforward, full-term baby who feeds well.
Sure, fair enough. I think it's then also important to emphasize that while feeds should not be longer than 30 to 45 minutes, they also should not be too short, because there is this thing called fore milk and hind milk. Can you talk a little bit more about that?
Yes, it's something that was recognized some years ago, that when you first feed a baby, they get the thirst quenching watery element of the milk. And that's why people tend to recommend that you feed primarily on one breast and only top up with a second side if your baby still seems hungry, because if you switch too soon from one side to the other and one breast isn't emptied, they get 2 lots of predominantly fore milk and not enough of the fatty rich stuff, which means A, they don't get the nutrients, and B, they get hungry more quickly.
Okay, that's super helpful. Okay, so when can you move from like 2 hourly to 3 hourly or 4 hourly feeds?
I wish I could answer that question definitively. I think it boils down to how frequently your baby is a feeder. You can't prescribe it. All I would say to you is, if a mum came to me and said their baby was 12 weeks old and they were still feeding 2 hourly, there is room to manage that. In the first 2 weeks, I would say you just kind of rock with it within reason. You have to make sure that you don't get into this snacking routine, because any less than 2 hourly, they're kind of having a little bit here, a little bit there, and they're never having a really good feed. So it's a fine balancing act. And the key thing really to know if your baby is feeding efficiently and effectively is whether there's plenty of wee, whether they are pooing regularly, and whether they are gaining weight and maintaining a centile curve. That is key to what health professionals are looking at to determine whether a baby is feeding effectively or whether some support is needed.
Now, how this is really interesting, but how do you know as a first-time parent whether the baby is peeing and pooing enough? Like, what are the quantities, or like what are some
Right.
benchmarks? And if someone works with you, can they just show you an appy and say, Dawn, is this enough?
The midwives actually and the health visitors have very clear guidelines in every trust which they adhere to. So they should be informing a mum either at the point of discharge from the hospital or during the early community visits to say, I would expect your baby to be producing this number of fairly wet nappies and this number of poos of a certain size for X number of days, and after that X number of weeks they will be doing. So it's something that is a fairly clear guideline which health professionals will happily or will be passing on to parents.
Okay, and I think there's another sign if baby is dehydrated, if they have a little like sunken skull. Is that the case as well?
As a general principle, yes. I mean, some babies naturally have more of an indentation. The little fontanelle there takes up to a year really to fully close over, so it can be an indicator. But if your baby has got good elastic skin, is lively, is not over sleepy, and appears to be feeding well, and is weeing and pooing plenty, I would say if that baby's well in every other respect, that would be one of the later things that you would be looking for.
Okay.
It's an indicator, but to me, not the major one in an otherwise fit and healthy baby who appears to be feeding.
Okay, so let's assume I'm now a master of looking at nappies and seeing whether they're full enough or not. But my baby keeps crying, and my first instinct is to feed them. Is that right?
I would say working with babies and why they're crying is always a process of elimination. And the more you get to know your baby, the more you will learn to recognize that your baby cries for a lot of other things. They may be crying because their nappy suddenly feels very wet and it's quite a cold day and they're not comfortable. There may be a bit of clothing that's tight. There may have been too many visitors and they're overstimulated. They may have had a sleep cut short for whatever reason, they're actually quite overtired. So I always suggest to parents that they run through a checklist of all the other possibilities if the baby has fed within the last hour to 2 hours.
Okay.
It may just be that they're having a growth spurt and they do need that extra feed. But again, it's about experiential learning for mums and parents. And this is why having help and support from whichever route you choose is incredibly important, because it just helps guide you, because you haven't got the time to read all the books or look at all the websites that will give you wild variations in information. And learning about your baby, you feel your way as your baby develops and their personality traits begin to show, and you know what your baby's normal patterns of behavior really are.
Okay, so I do think we have established that ultimately it's actually quite a complex task to sort of learn about your baby, to learn about like their feeding, what do they really need because they don't communicate properly, and like what kind of parent you want to be.
Yes.
But if we were able to summarize, like what are the key things that parents can do in terms of feeding, like what are the 3 to 5 key takeaways for a new parent when it comes to feeding?
I think to be realistic about what you choose as your feeding method, and retain flexibility without feeling pressurized. It doesn't happen very often, but I would hope that in this day and age that no parent feels totally pressurized to do something that causes them so much distress that it has a less than positive effect on their baby, because the mum is the pinnacle of all of this, and the mum has to feel supported no matter what choices she makes, and she has the right to receive the right information to enable her to make the right decisions, informed decisions, and have those respected. I think the second thing is to monitor your baby, as we've said, you know, for the wee, the poo, the intake, and just make sure that your baby's gaining weight. The other thing is to run through your checklist of whether your baby is crying maybe for another reason, and not be too quick to just feed every time they cry, because then that will increase the association. Every time a baby cries, they expect to be fed, then that will create a bit of a cycle which is less than helpful for anybody.
Yeah, judging from my own personal experience, that was probably the biggest mistake I've done early on, thinking that every cry was actually, I'm hungry. But looking back now in hindsight and everything that I know, most of those cries were, I just want to sleep, help me
Yes,
sleep. And that's
yes,
that's another that's another big topic which we're going to be addressing in another session. Um,
indeed. Yeah,
so thank you so much for this, Dawn. It was a pleasure to
you're
have
welcome.
you.
Thank you very much. Bye, Zara.